Greetings to everybody. Hello, hello to the world and welcome to Power the Youth. Thank you so much for joining us at this event as we look at the role of young people in the plight as we change the world. My name is Loyiso Madinga and I'll be your host for today, helping things run along as we look at these NTDs, these neglected tropical diseases. So neglected, in fact, that I first heard of bilharzia maybe 2 years back. And 2 years later, I still can't spell it. And as you will see throughout this program, that is just one of the many hurdles we are having to overcome, is just these names that seem so far away from people. I mean, information is so important when it comes to these things. I remember when I was traveling in Thailand some years back, and we just hear about this dengue fever, which is, I didn't know what it was at the time. And it was very hard to find more information about it because the view was just so pretty. You'll forget about any disease when you're in Thailand. But today we're here to learn, and we have so many great speakers here with us, and we have some professionals that you can get a hold of. Yes, we would like you guys to chat with us. Please ask any question that you might have to our specialists, who are the wonderful Dr. Ersun Baisenge from Global Health Equity, Dr. Mwele Maletela, Director of the Department of Control and of Neglected Tropical Diseases at the World Health Organization. Yes, that's a title so big, her business card is an A4 piece of paper. And last but not least, Dr. Niraj Dhingra, Director of the National Vector-Borne Disease Control Program. So please stay with us. We will be learning as much as we can, and we'll be hearing from great speakers along the program, including these professionals. Now, along with the questions, we would actually also like to hear your opinion. Not Twitter type opinions. Let's stick to the program over here. There's no hate on this one. So send us your comments and your thoughts as we go along. And to help you understand how that's going to, my brother in London, my brother from a
Thank you very much, Loyiso. I think I'm clearly going to be the straight man when it comes to this broadcast. Well, throughout the broadcast, please make comments in the chat box. If you would like to watch it with a French translation, en français, click on the English button at the bottom of the video and select French from the drop-down menu. During the show, we'll be putting up some poll questions on the top right of your screens. Poll questions like, be honest, are you watching this virtual event while wearing pajamas? You just have to pick one of the three options below. Yes, no, maybe. It's easy. The questions and results will all appear there as well. Keep an eye out for them and give us your opinion with every question. I'm looking forward to your answers, but for now, back to you in Johannesburg. Loyiso, my brother.
Thank you very much, Henri. Anybody who, by the way, has to answer the simple question, are you wearing pajamas right now, and says maybe, is wearing something much more questionable than pajamas at the moment. So please remember to chat with us, keep informed and listen through. Now, this youth movement was started in Dar es Salaam on the 27th of this year, 2020, in February. Now, this was helped to empower, to support and engage a new commitment to all of these communities so that they can one day become NDT free. And to help us focus on this led initiative, we have designed a participation of young people of NDT communities across all of these activities. Now, let's take a look at what that little summit involved.
Having consulted, a couple of people, we put together a declaration. And this declaration is different in that it's not only an ask from leaders, though. It's also a commitment by young people of what it is that we want to do as young people in the fight against NTDs.
I signed the declaration, and it's important for me to commit, I myself as an individual, apart from my work, but to commit to make sure that I educate other people, I bring awareness.
The declaration was important because young people were involved, not just participating as young people, but they were meaningfully engaged into this discussion. And this is something that we actually have been looking for. And young people are now going to get an opportunity to emphasize this in their countries.
Because with this declaration, we want to go knocking on doors, Togo. Dr. Mwele, and interestingly enough, someone asked her the question about the roadmap. It is actually on the declaration.
So you give me a great challenge to ensure that we actually put in a statement on youth in the roadmap. And I'm very happy to leave here and go and do that.
So that is a commitment. Thank you very much, Dr. Mwele.
It is great to see the young people making a real commitment towards an NDT-free world, NTD-free world, a real commitment. They even signed a document, just like marriage, a real commitment. And just like marriage, if they decide to leave, the other members take half of what they have, just like marriage. Now, to help us start today, we are going to have our opening address, which I had offered to give, but apparently you have to get an important person to do it. So we have today the Minister of Health from Guinea-Bissau, Dr. Magda Robando.
It is a great pleasure for me to join this massive group of young people who have joined for this special event, which is bringing together people from all corners of the world to reflect on how best we can use your power, your energy, your enthusiasm, and your passion to roll back and fight back neglected tropical diseases. I think I should start by congratulating you all for launching back in February a youth movement against NTDs. I'm excited to hear that the movement is growing by the day, and you are all enthusiastic about it, playing your part, doing your best to make sure that we live in a world that is free of NTDs. And by doing that, you'll be the first generation to live in a world free of NTDs. That's so amazing to think that 1.2 billion young people around the world, yes, that's you. You make 16% of the global population. That's 1.2 billion possibilities, 1.2 billion activists who can definitely put an end to neglected tropical diseases. I'm excited because I've been passionate about ending the neglect, ending these diseases that have been devastating our families, our communities, our mothers, our children. And I can't wait to see that this youth movement that you have started in February is going to be the movement that will bring an end to the disease that starts at the end of the road, where people don't have anything else to hope for than go home and sit with the disease that makes them impossible, make their lives impossible, makes them not able to earn their living, make them unable to go to school, to work and to lead decent lives. I'm excited to hear that young people like you, and I can say it again, 1.2 billion people aged 15 to 24 around the world committed to join this movement to help poor communities, neglected communities, forgotten communities to end neglected tropical diseases around the world. I'm from Guinea-Bissau, and my country is also affected by neglected tropical diseases. We are doing relatively well. We have been able to actually extend preventive chemotherapy to about 70% of the people. And we are on the verge of eliminating trachoma, but that's not everything. We still need to mobilize governments. We need to call governments to account, call governments to bring the leadership they need to in order to leave a better world for you. We have 2030 agenda to meet. We have the goals to achieve, and we can't do that just with the kind of leadership we have today. We need enthusiasm, we need passion, we need people like you, we need your energy, we need your resilience. And we need your irreverence. You know, in Guinea-Bissau, 60% of the population is made up of people less than 25 years old. That's a lot of people full of energy, and they are fighting in all fronts. The young people in Guinea-Bissau are fighting for democracy. They're fighting to fill the digital gap. They're fighting for dividends. They are fighting for disease control, and they are also going to be part of this global movement. I'm proud of you, and I want you to keep going because we are behind you, and I'm sure you will be the generation that is going to end neglected tropical diseases. I'm sure you are going to be the generation that will live in the world free of neglected tropical diseases. We shouldn't leave anyone behind. And we need to make governments to account. You young people can do it, and I count on you. So I wish you a fantastic meeting, and please enjoy as much as I'm enjoying being here with you. Thank you.
And thank you, Dr. Magda. You can really feel her excitement about the youth getting on board with that youthful energy, because you need that. We need that, the young people with the energy that we give to taking a selfie, that same relentless try over and over again until it's perfect kind of energy. So thank you, Doctor, for starting us off. Now it's all about the youth, and all around the world, we have our NTD advocates who we will hear from throughout the show. Now, they're not advocating for the diseases. No, they're not out there going, go trachoma. These guys are here committed to helping others and changing the world. One of whom is all the way from Cameroon, mon frère, Elondu.
Greeting from Cameroon. My name is Elundu Roland. I am an NTDs advocate because I come from a community where several NTDs are currently endemic. In my country, NTDs are currently affecting million individuals and are responsible for the maintenance of the cycle of the poverty by preventing individuals from leading productive and by adversely affecting families, communities, and the country development. Therefore, I am strongly motivated to improve the life of individuals living in endemic settings by improving their health, which is the key determinant for the development of the country.
A great message there from Ilundu, showing us that we, the people of the community, can go back and really make a difference. Next up, we hear from Noella, who serves as a strategic advisor to the Rwanda Biomedical Center. And he will be talking to David Molyneux, who is the Emeritus Professor at the Liverpool School of Tropical Medicine. And I'm sure he won't mind me stating this. He is 70 years old. That is right. To have made this digital conversation we're going to see, it probably took as many younger people as it took for me to do my first TikTok. Please see, welcome the doctor, and let's see what they had to talk about on the online chat.
And so I'm Noella Bigirimana, and I work in public health. I work in the Ministry of Health of Rwanda. And it's an absolute pleasure to be here, especially with the theme that we'll be discussing today around this neglected tropical diseases and the role of intergenerational dialogue. So yeah, if you can say just a few words about who you are, David.
Very happy to do so. I'm Professor David Molyneux from the Liverpool School of Tropical Medicine, where I spent most of my professional career. I've been working on these diseases since I started as a postgraduate student, horribly, in 1965. So I've worked on many of the organisms which now constitute the group of neglected tropical diseases. So I have some familiarity with the science, the history of the movement, and at least I have, I hope, some perspectives about the future and the direction in which we should go.
I want to hear a little bit more from you as a scientist who originated the term neglected tropical diseases. how did the NTD movement start?
Now, in around 2000, I was privileged to join a group in Liverpool who started to work on the lymphatic filariasis program with support from GlaxoSmithKline and the UK Department for International Development. And during that time, having had some experience on sleeping sickness, leishmaniasis, river blindness, and then filariasis, it struck me that we were dealing with diseases which afflicted a very large number of people, but actually didn't have a voice, a strong voice at all in the international global health community. At the same time, 2000, you'll be aware that the Millennium Development Goals were launched by the United Nations. And one of the health targets there was to focus on, and this was a statement, HIV and malaria and other diseases. That concept in the Millennium Development Goals was a little bit frustrating for several of us, and I wasn't the only one who was thinking about neglected tropical diseases at the time, because in the statement he said malaria, HIV, and other diseases. Didn't include TB, didn't include poliomyelitis, where there's an awful lot of money going into the immunization program, and it just frustrated me that diseases which are causing so much pain, hardship, suffering, disability were just categorized as other diseases. The problem I think we faced was that with the big WHO list of neglected tropical diseases at the moment, they are not words that flow off the tongue. Leishmaniasis, schistosomiasis, onchocerciasis, etc., were not something that the broader public could understand. They were just long scientific names describing infections of poor people. So in WHO, there was some enthusiasm for bringing together a group of colleagues to study how we could go forward to sort of package these diseases and make the development problems and the health problems more conspicuous on the international health agenda. 2 meetings were held in Berlin, and the seminal meeting was in 2005, when WHO decided that they would adopt the term neglected tropical diseases and form a department in WHO which would specifically address this group of infections.
COVID-19 has painfully exposed the existing health and social inequities in our societies. And I wanted to ask you, David, in this context of COVID-19, can you tell us a little bit more? Can you discuss a little bit more about these inequities that are impacting our communities?
The key thing about COVID is its biological characteristics. It's highly infective. It's got asymptomatic carriers. It causes death. But as you say, it creates massive inequities. I would say, though, that in relation to NTDs, whilst WHO guidelines have suspended mass drug distribution, for example, and also surgeries, which is entirely sensible because anaesthetists, people who are doing eye surgery for trachoma, for example, will be at high risk, as will their patients. So I think that it is wise to do the correct thing in terms of safety for patients and health staff. For MDA, I'm somewhat skeptical that the problems of MDA can be resolved and there will be any benefit from suspension. Let me explain why. Mass drug distribution has been based on the extraordinary support of community distributors and community health workers. They are core to this because they reach the periphery, they understand their communities, they are respected by their communities, and they're trusted by their communities. And in any setting of this nature, I think the communities have got to be the people, the leadership in communities who have got to respond. The success of NTD mass drug distribution in rural areas certainly has been the high coverage because of the trust that CDDs have had within those communities. Now, in many settings, their communication, their understanding of the communities, they're the eyes and the ears, and they're the distributors. And I think we should use those individuals to initiate MDA within the safe guidelines which have been constructed, using methodologies which they can understand the communities will accept. I think that it would be tragic if mass drug distribution was stopped and suspended for any length of time, for two reasons. One, you're depriving communities and poor people of essential drugs. All the drugs used for mass drug distribution for NTDs are on the WHO essentials medicines list. So I think there's an equity and human rights issue here. And also because other programs, for example, seasonal malaria chemotherapy and EPI, immunization programs, will need to go ahead. If those programs are suspended, it may well be that will be an increase in risk for the very young children, who, by the way, are less susceptible and less prone to serious effects of COVID. So I think that there is a good case for integrating these community-based interventions, seasonal malaria chemotherapy, EPI, NTD mass drug distribution together within the boundaries of safety, social distancing, if necessary. So I think that there's a case to make that say, look, we're going to have COVID here all the time. It's not going to go away. There's going to be a baseline of a plateau of virus infections for many years until a vaccine hopefully comes along. But in the meanwhile, we cannot afford to jeopardize the health of, let's say, under fives because they're deprived of seasonal malaria chemotherapy, they're denied access to EPI, because then you're going to stack up huge mortality if there are epidemics. So I think that we have to have a balance here between what we must accept now, I think, as a long-term virus infection, which is not going to go away unless there's an effective vaccine, and the reality that people need health interventions to continue. And I think that's their right.
What do you want young people to know about their role and the role they can play in the fight against neglected tropical diseases?
We have to serve as we become medics in the future. So these are the sort of components which youth can bring to this. But I think the principal one is really advocating for more and sustained interventions within their own populations and communities. So they relate back to those people who have influence the tragedy of some of these diseases in the populations which they're going to serve and from where they come from.
Thank you for this words of encouragement, because I think for us, the youth, when we hear from you, we get to see where we're headed. And I know you're coming along with us and telling us, this is how you can mobilize. This is how you can fight neglected tropical disease. This is how you can play a role in the future in this community. David, it's been an absolute pleasure.
私たちは日本のそして世界のユースとして帰り未来の年代を NTDs の契約に向けた取り組みを応援します。
Thank you, Noella and David, for that fascinating intergenerational exchange. Needs to see more of that. And thank you too to the youth team from Japan for showing the NTD youth movement is thriving all over the world. Now, earlier on, we talked about our resident experts answering your questions. And with me now is Dr. Niraj. Dr. Niraj, greetings. How's it going?
Thank you. It's been very interesting in listening and seeing all the energetic voices that are going on in this session.
Excellent. Now, having listened to what David and Noella talked about, how do you think young people can help with your program in India?
Great. Thank you very much. You know, India is definitely poised for elimination of NTDs, and we definitely look forward to the young population in this endeavor. As in India, they constitute nearly 35% of the Indian population is young. So As we all are aware that NTDs basically infect people quite early in the age, and then the clinical symptoms and disease develops quite later in life. It becomes very important that young population is aware of the means of transmission and how to prevent infections. And that's the place where the young population, the youth, can really become champions and leaders in promoting awareness on this aspect. Also, look at the technology and IT savvy the young are, and they can be very helpful in spreading the messages on prevention, control, and treatment of NTDs. I look forward, young can become advocates of NTD elimination programs all across India as well as globe. We from the program side would like to engage with the young people and involve in our policies and help in, forming youth governance groups, councils on NTDs, advisory bodies on NTDs. Young population can also play a very important role in counseling of the patients who come to the hospitals. They can also work as volunteers in morbidity management or help giving the right techniques to the patients on self-care, especially on the morbidity management in lymphatic filariasis that we face in India. This population just so enthusiastic, passionate, and dynamic. Engagement with local communities can be one of very important component where youths can engage in. We look into the convincing of local leaders in activities like mass drug administration, safe water hygiene, and so on, which are very important for prevention and elimination of NTDs. Forming youth-friendly NTDs, that will be very important. That means if we have at local level a group, youth-friendly group, which can disseminate all the information and can also act like a boost to community engagement where the government normally is not able to reach the last mile. So that will be very important, that where we can. And we have some experience in engaging in India with young groups, and that has been quite successful, especially in mass drug administration and also in the triple drug that we are doing this. From our side, we can definitely facilitate forming a young platform where the young population can come in, and we can also discuss this in an institutional manner with them. And the views of the young are very important in deciding the public health strategies which will go for elimination of NTDs.
Excellent, Dr. Niraj. You've given us a whole range of ideas, given our young people in India a lot of tips, and hopefully they will hang on to those and mobilize in the way that you have suggested. So we'll hear from you again later, but don't forget, our experts are here to answer any questions you might have, and please keep sending in your comments. I'm sure you'll want to say something about this next piece. It's a performance from Kenya's premier spoken word poet, the multi-award winning, always compelling, Teardrops.
Mahatma Gandhi once said, the true measure of any society is seen by how it treats its most vulnerable members. I've lived in two worlds. I've seen the wonders of the world. I've seen men go to the moon and back. I've seen men building the greatest wall. I've seen men drilling the deepest hole. I've seen men not asking for a cup of water but Wi-Fi passwords. I've seen men finding water on Mars. I've seen it all. So what's the need of men going all the way to Mars to find water and a fellow man on Earth can't find water? I refuse to live in a world where it's easy for an army to disperse protesters with water cannons that have clean water, but it's hard to combat parasites that are living in water. I refuse to just stand and watch diseases with complicated names trying to complicate lives. It's sad to watch diseases that you only read about in theory being practical on bodies of the people that you care about. We can't afford to fail both on our biology exams and also fail in taking care of ourselves. See, where I'm from, our drinking water is not only polluted, it's also electrocuted. And if I tell you how many people die from drinking water, you'll be shocked. I refuse to live in a world where sewer lines, clean water lines, and illegal power lines run concurrently, apparently. I refuse to live in a world where men stay up late to watch 22 people kicking a ball, but there's a million people out there with legs too heavy. with the size of a ball and nobody's having sleepless night. I refuse to live in a world where we have free waterfalls, but not free water for all. I refuse to live in a world that the water we flush in our toilets are 100 times cleaner than the water that other people are drinking. I refuse to be in a world where the water in swimming pools are getting a much better treatment than the water that our fellow men are drinking. And those are the things that make me sick. A man going without food for 3 days and that without water for 7 days doesn't make someone strong, it makes you weak. I refuse to live in a world where politicians can go to the driest part of the continent to look for votes, but not to distribute medicine or information to those that matter the most. If water can make it to the mountain, through rivers, to villages without proper channel, why can't men do that? I refuse to live in a world where creatures that can't be seen growing bigger than Hollywood movies and start creating sin. I refuse to stand and watch water taps running and others can't find water. If water is life, it's so sad now it's included in 1,000 ways to die. So when you go to sleep tonight, I want to think about the people with worms that even early bird are afraid to catch. And if faith heals, I think we should create more hospital in the church.
I want us to think of the neglected people living with neglected tropical diseases.
Thank you very much for those wonderful words there, Teardrop. Speaking about one of our most essential resources, which is clean water, and the answer to many of the problems that we are facing with these NTDs. Thank you very much. That was very beautiful. Now, we are hearing that there are some issues with some of you are experiencing with your lines. We will try as hard as we can on our side to deal with these. As we continue with the idea of water, we look to our brother all the way from Kenya to give us a story about a more personal perspective on the need for potable water. As a member of the Youth Advisory Board all the way from Kenya, it's Jeffrey.
Hi, I'm Geoffrey Mondi Otieno from Kenya, and I'd like to give a brief account on my interaction with schistosomiasis as a child. Now, I spent a better part of my childhood in Nyanza province, that's in western part of Kenya, around the Kano Plains. Now, this region was characterized by frequent floods, poverty, rice farming as a main economic activity, as well as lack of access to clean water. Now, all these factors always conspired to ensure that schistosomiasis was always present in our neighborhood. And I remember very well the toll it took on my own family, as a week could barely pass without a member of my family being hospitalized. Now, this did not only affect my family, as I remember children being disfigured in our neighborhood. I remember other children being disabled, some even losing their lives as their parents could not afford the cost of medication back then. Now, as we speak right now, these problems are still prevalent in our communities. And I believe that there are still huge opportunities for global collaboration towards combating neglected tropical diseases. I believe in intersectoral collaboration to combat these diseases, and I believe that governments can still do more in terms of budgetary allocation towards addressing neglected tropical diseases. Most importantly though, I believe that the youth play a critical role in making decisions that would ensure lasting solutions towards combating neglected tropical diseases, and therefore they should be actively involved in every step of the way. Thank you.
Some perspective there from my brother Jeffrey. We have to ask ourselves, how do we solve this issue of getting potable water to everybody? And how can the youth get involved in being part of the solution? As part of our advisory board and 360, please welcome all the way from Bangladesh, Shomi.
Hi everyone, my name is Shomi Hassan Chaudhuri and I'm a water sanitation and hygiene activist from Bangladesh. I'm the co-founder of a global youth organization called Awareness 360, which empowers young people in 23 countries to contribute to the global goals. Recently, I've been appointed as a Youth Advisory Board member for Youth Combating NTDs, and I'm extremely excited to be joining this movement. The first time I read about NTDs was back in 2016 through a WHO article, and that intrigued me to find out more about this topic. And as I was doing my research, I was shocked to find that my homeland, Bangladesh, is actually one of the high-burden countries for NTDs. I'm sure, just like me, there are many other young people who didn't know about NTDs, but they do have the immense potential to contribute to this movement. One of the ways we can engage young people is by tapping on their advocacy skills. NTDs are preventable, NTDs are curable. So it is very important that we send the right message across to these communities. And this is where young people can play an important role. They can reach out to their communities, given that they are provided with the right resource, the right knowledge and information, and they can build awareness at a community level. They can also bridge the gap between the bottom and top level of the pyramid. So for example, they can take their experiences in the grassroots level and bring it to the policymakers, bring it to the decision makers, and vouch for the right policies to be implemented. They can hold the decision makers accountable. So I think we really can play an important role by working hand in hand in catalyzing this change. Another thing I feel very strongly about is the integration of the WASH agenda to this movement. This is because the provision of WASH facilities is very critical in ensuring the prevention and cure of all of the NTDs. For example, there are some NTDs which lead to permanent disability, and for those people, if they don't have access to WASH facilities, it becomes very difficult for them to lead life. And ultimately, NTDs lead to poverty, NTDs lead to lack of access to opportunities, and billions of people are suffering from NTDs, billions of people are dying, and they're leading an extremely hard life throughout the entirety of their life, and this is unacceptable. So let us work together and make sure that no disease is neglected. Thank you.
And thank you, Shomi. Yes, talking to a very important point. The youth can be a very, very important link in terms of information to their community. I know this because I'm constantly having to tell my mom back in the rural areas that she has not won 5,000 Rand in a competition she did not enter on WhatsApp. No, I have the internet, mother dear. And now we look to our chair of the Commonwealth Youth Health Network, Lucy.
Hi, I'm Lucy. I'm a young public health practitioner here in the UK, and I wanted to talk about why I'm calling for an NTD-free generation. So back in 2018, which feels like it was a long time ago now, I attended the CHOGM, or the Commonwealth Heads of Government meeting in London, and I was shocked about what I heard about the scale and also the impact of neglected tropical diseases across the Commonwealth. But these shocking messages, and I think the facts and figures were definitely shocking, they were also tempered by some degree of hope. So advocates were there from civil society, from governments, from donors, and they highlighted the change that could be brought about by true political leadership. And they talked about how civil society were taking action and driving accountability on the ground and the change this was making. But for me, I think it felt like one voice was missing, and that was the voice of young people. And I came away feeling that this was a missed opportunity to really drive change. In my advocacy as chair of the Commonwealth Youth Health Network, that's a very exciting role I've had to work with young people across 54 diverse and very diverse countries in urban and rural communities in a range of different contexts. And I can see the way they are already mobilising for change on the issues that are most important to them and threaten their futures. I believe that tapping into this sort of dynamic energy of young people and their hopes and their actions for a better future is critical to the effort to eradicate NTDs, and furthermore on the pathway to achieving UHC. Taking on NTDs, truly eradicating them, requires action by all of us, from donors, from national governments, from civil society and private sector, and from young people themselves. I've recently joined Youth Combating NTDs to see how we can take this challenge forward, together with young people, driven by youth-led solutions to leverage the amazing power of young people to create an NTD-free generation. We will empower, we will advocate, and we will act to ensure this becomes a reality for all. But we as young people cannot act alone. We need your commitment and support to realise this vision together.
Thank you very much, Lucy. We will empower and activate. And act, because NTDs are solvable. That's the thing. The solutions are there. We just need to mobilize and organize and keep the energy up to finally get to that finish line. Now, some of these solutions are actually very, very practical, and they take a little bit of technology and a little bit of
This was probably 4 or 5 years ago during one of my lectures. I was quite puzzled and I wondered, why would the world choose to term them neglected tropical diseases? Are we choosing to neglect them? Yet we continue to lose human lives, and individuals living with neglected tropical diseases continue to suffer from the disfiguring and even stigmatizing impact that these diseases have. What we're doing now as International Pharmaceutical Students Federation, representing over 500,000 pharmacy students and recent graduates, is conducting awareness campaigns to make our members more knowledgeable on neglected tropical diseases. We plan to further engage our members by encouraging and supporting local interventions at the community level in the different countries. Partnering with Youth Combating Neglected Tropical Diseases is an opportunity to expand our reach. When it comes to the potential that my area of work has in addressing neglected tropical diseases, pharmacists are some of the most accessible healthcare professionals, meaning they're better placed to educate their patients and the public on neglected tropical diseases, how to prevent them, and what it takes to eliminate and eradicate them. What does youth advocacy in neglected tropical diseases look like? This, to me, is more of speaking up and taking action. We're a generation that is capable of changing the narrative, and neglected tropical diseases is an area we can do this. This is through educating the public, engaging in policy, and making personal commitments to fight neglected tropical diseases in our immediate communities. Therefore, as IPSF, we are committed to preparing future pharmacists that can and will aid in the fight for an NTD-free generation.
Thank you, Luce. Thank you, Purity. Talking about we are the generation that can change the narrative. And it just takes a little bit of practical usage and some different thinking of how we can use technology. Some things that maybe your parents told you were just toys when you were young could be part of the solution. For example, zipline. Here with more is Israel.
And I work for Zipline. Zipline is building a technology and a service around delivering medical products using drones. And our work is related to NTDs because we are able to deliver medical products as fast as possible, wherever possible, using drones and ensuring that there is access and there is no lack of NTDs medication in any place a patient would need them. The people who are usually affected by NTDs either live in rural areas or live where facilities are, challenging to access. The other thing about NTDs is that the patients are usually very few in numbers. And so to be able to supply all of them with medical products, they either have to be transferred or, medical products either have to be transported to where they are. However, that's not how the systems of medical supply chain are usually built. So with our services and technology, we are able to reach as many patients and as many health facilities as possible from a few points. And using technology like drone delivery, we are able to reach even the unreachable, thence preventing the need to transfer patients to come centrally in cities, or the need to be able to spend so much to make sure that they get the services and the products that they need wherever they are. And so we now make sure that wherever they are, to the facility closest to your home, we are able to deliver medical products there on time and when they need them. The main challenge that we have with NTDs is the lack of engagement, political will, and funding to be able to add them on the agenda of national priorities for healthcare. And so young people should be cognizant of that and be able to strongly advocate and be the voice of completely eliminating NTDs by engaging their policymakers and creating an awareness campaign and be able to drive the need to create awareness and create funding and programs to be able to address all NTDs.
Bravo to Israel, Bimpe and the people at Zipline. What a great story. Okay, let's see how our experts are doing. And this time we're talking to Dr. Ursin Bayesenye. How's it going, Dr. Ursin?
It is going well, thank you.
Excellent. Now, here's a question for you. What key roles do you feel young people can play in achieving that all-important NTD-free generation?
Thank you. The power, the energy, and the capacity of the youth have long been missed opportunities. COVID-19 is a great example of how what we call normal can change in a second and affect humanity. The youth adapt quickly to changing situations and has proven to bring innovative ideas that could potentially change the course of NTDs across the globe. This event itself demonstrates what the youth is capable of. Seeing my brother Gerald, the founder of this movement, is inspiring. I see NTDs as the fastest way to achieve SDGs, and luckily NTD can be drastically controlled through simple interventions like washing hands, wearing shoes, raising awareness in our community. And this can only be achieved collectively. So youth from different areas have something concrete to offer. Innovative ideas such as manufacturing shoes for the most vulnerable would help to combat snakebite envenomation, podoconiosis, soil-transmitted ehrlichiosis. And with those simple interventions, we can save millions of people. Mobile phones are penetrating our societies, and social media is now more understood by the youth, which means they can leverage that to mobilize the youth. Therefore, at this end, I'm asking policymakers who are listening to us to root for us and support this young generation by all means necessary for a great cause of living in this NTD-free world. We want to positively change our society, and the one thing that will allow us to reach SDGs 2030 is to eliminate NTDs. Everyone is held accountable. This is where I keep stressing the role of the youth on this NTD stage. Thank you.
Excellent, Dr. Ursin. Thank you very much. And I know you're on standby in case of people have got any questions they want to put to you. Now, recent events have shown that young people want to and are prepared to take a lead to make a change. Earlier this week, we eavesdropped on a conversation between the incoming Youth Advisory Board member, Michael Sheldrick, youth champion from Tanzania, Maria Teresa Kadush, and from Canada, incoming Youth Advisory Board member, Matt Hewson. Here are a few snippets of what we heard.
So Matt, Maria Teresa, thank you both for joining us today. My name is Mick Sheldrick from Global Citizen. We're an international advocacy organization, and we are thrilled to partner with Uniting to Combat NTDs. And Matt and Maria Teresa, thrilled to be in conversation with you for this session today. What I was hoping before we get into it, Matt, Maria Teresa, if each of you might be able to just briefly say a few words about yourself, your organization, and your work on NTDs. Maria Teresa, why don't we start with you?
As introduced, my name is Maria Teresa, and I am from Tanzania, East Africa. I am the founder and lead team of Mobile Afya, which is a startup that works to provide basic health information in local and native languages. And we have started with Swahili in East Africa with the hope to expand in other spaces around Africa. Our work around NTD is that we have a feature that covers NTDs diseases in Swahili. And what we're hoping to achieve is to provide awareness and access of health information to local communities so that they know what these diseases are, what are the symptoms, where to get care.
You do very important work, and we're thrilled to have you. Matt, how about yourself?
My name's Matt. I'm from Canada originally, but living in New York City. And one of my first global health jobs was with Evidence Action's Deworm the World initiative. So working on school-based deworming in 6 different countries, and that really shaped sort of my views on global health and what I've done since then. I'm really passionate about community organizing and leadership development, and I'm actually working full-time with an organization called Cities Rise, where I work with youth leaders and come behind youth leadership to advance mental health in countries around the world. So really interested in the intersection of mental health and NTDs, and excited to be rejoining NTD work as an advisory board member for Youth Combating NTDs.
So at this moment in time, you know, why is it that young people should care about NTDs?
You know, NTDs should be addressed because there's a human rights issue and their challenges in and of themselves. But if we look at, just for an example, NTDs and mental health, people who are suffering from NTDs and their caregivers face significant mental health burdens. And that means that both NTD programs improve mental health, and also that NTD programs need to take into consideration the mental health of the people that they serve. And even taking a step back on the idea that these challenges are intersectional, I think we know from public health that the systems and environments where young people and people work, live, and play significantly impact NTDs and how to address them. And I think that young people are uniquely well equipped to tackle such complex intersectional issues and to come up with creative ways to address them.
It's interesting, Matt, you know, at Global Citizen, and we're a movement of millions of activists around the world, we often say, you know, we can't address poverty, which is our mission, to see a world without extreme poverty by 2030, unless we focus on neglected tropical diseases. Equally, we can't address NTDs unless we address poverty. The two are two sides of the same coin, and in that they both, to me, are core to the Sustainable Development Goals. You know, we talk about this notion of equity, the idea of leave no one behind. And for me, it's simple. If we can't meet people in some of the most remote, vulnerable communities with access to life-saving treatment against these horrendous diseases, you know, how can we talk about access to sanitation, other forms of healthcare? You know, I really think it could be a litmus test and is the proof point to achieve the goals. Maria Teresa, you know, how about, you know, in the work you do, why is this so vital? Why should this be something with so many issues that the world should focus on right now?
When you have other crises around the world, it doesn't mean that the existing issues and the existing problems stop. So we still have NTDs, especially in the African perspective, where they affect the marginalized group, the most poor people. And with the continent that has majority of its population being youth and young people, these diseases affect us. They affect mostly people of our age, and they affect young people. And for this reason, we feel that we have to take the driving seat, and we really have to do the work to make sure that these diseases that are preventable, that are treatable, do not continue to affect our generation and the generations to come.
Maria Teresa, your specific focus, you mentioned earlier, is the use of technology. Maybe you can just tell us a little bit more about the app which you've helped develop and promote.
Our app is called Mobile Afya, and what we do is provide health information, and one of our focuses is NTDs, where we provide easily accessible basic information on what neglected tropical diseases are. And we cover now 5 different diseases with information about symptoms and where to get care and at which stage. And really, we urge people to go and seek care, especially people in rural areas and in highly affected areas. And our main goal is to make sure that every person who has a mobile phone, which now is more than 40 million people in Tanzania, can access this health information, including awareness and education about neglected tropical diseases, so that people can take preventive measures and are not highly affected to severe cases, as how we see in most of the areas in Tanzania and other parts of Africa.
As you mentioned, we really need to build the social movement to address and to combat NTDs. I think doing incremental improvements and work through the more traditional global health channels is important and needs to be done better, and is also not enough. Like, we really need people, especially young people, actively advocating to their governments for more action, for more resources, and to hold governments and organizations accountable. You know, as a Canadian, we need Canadian politicians and political parties to know that young people's votes depend on whether or not they make the right global health commitments and live up to them.
You know, I guess I'd ask each of you, maybe you could leave us with a hopeful story, you know, a heroic story in this endeavor that inspires. It could be of a person, it could be of a particular tool, it could be of a specific technique on how you reach people, but something that gives you optimism and hope in the fight to beat NTDs.
What gives me hope personally is that looking at the history, all the biggest movements, starting with the civil rights movements to the fighting injustices in Africa to freedom in African countries, were driven by young people. I mean, what we see now with young people wanting to take the driving seat and wanting to be the last generation is because we have seen it done before, that we have the art, we have the spirit, we have the capacity, and also we have the personal connection that we don't want our children, we don't want this generation to continue suffering and enduring the same problems that we have. And this has been the fighting spirit. This has been the spirit that has brought up transformational changes, has freed countries and people from injustices, and they were all done by young people.
You know, there are a lot of individuals that inspire me, but I think what gives me the most hope, whether it's in the fight against NTDs or racial justice or climate change or anything else, is just the power of community and just what we've seen time and time again, when people, and especially young people, come together, and we don't just, you know, band together and building awareness, but really in true solidarity with each other, where we're comfortable, you know, calling each other out when we commit to something and don't do it, where we're comfortable having a shared voice and really using that to advocate. I think we've just seen time and time again that when we want to make progress on such deeply rooted, wicked challenges, we need to do it together, to hold each other accountable, to give each other grace, and to really struggle together. And I think that's what just observing that happen and thinking about the potential we have to do more of that with Youth Combating NTDs now having a cohort of 800 young people around the world committed to the struggle. I'm just really excited about what we might be able to do together.
It's often said that crises are remembered for as much as how they end, for how they begin. And so I hope in 10, 20 years' time, when they write up, you know, the history of this pandemic and how it ended, that the story they will be able to tell is how countries came together, poured their resources, and allocated test treatments and vaccines according to those who needed it first, the frontline health workers, the most marginalized, and in doing so, you know, charted a course to tackle all these other diseases, horrendous diseases, and indeed achieve the sustainable development goals more broadly. And so I think that's what gives me hope about what might come out of this year. But Matt, Maria Teresa, thank you so much for giving up your time. I've learned a lot and been really inspired by your stories and appreciate you sharing it with us today. Thank you.
And thank you too, Michael, Maria Teresa and Matt, especially for easing us toward a hopeful end. And let's go and visit our experts for a final time. Dr. Mwele Malachile, how's it going?
Very well, Henry. How are you?
I'm delighted to see you right in front of me.
Really nice to see you.
Excellent. Now, we've heard how important the youth are in ensuring we meet our NTD goals, but how are we building the leadership capacity to prepare young people to be the future leaders in this all-important space?
Right. So I think the most important thing is that we need to invest in our leaders. And I think I'm really excited by the energy and enthusiasm that the youth bring to the table. And in order to, and the power and the passion and the use of their platforms in challenging us to do things differently. I think it's really important in investing in leadership, in ensuring that the youth do get a place at the table and that they are part of our discussions. Because right now, they are challenging us to do things differently, and we really appreciate that. I also have seen through their commitment through the through the Dar es Salaam Declaration, how committed they are not only to NTDs, but to the NTD roadmap, which has been developed to start from 2021 to 2030. So I think the power of youth we have not harnessed it enough. And I think we say that again and again, but we have not harnessed it enough. And so building capacities, giving them leadership, letting them lead and letting them guide us, these great ideas that the youth have shared with us today, the ideas on technology, the use of drones, etc. Giving the youth leadership roles, let them lead, let them show us what can be done, what is possible. Let them continue to inspire us. I think that's the way we will be able to move forward. I'm thrilled at the levels of engagement that this youth movement has had, and the way that they have been able to continue promoting the NTD message. And so I think in them we really do have able, strong, and dedicated partners, and I believe they are the generation we've been waiting for. And so let them lead, because they do have great things for us in moving forward.
And Dr. Mwele, thank you very much. And as I say in my mother's church, amen. And a huge thanks, they do. And a huge thanks to all three of our experts for answering and continuing to answer your questions. Now, throughout the program, we've heard from a wide range of people from around the globe. Our final youth advocate is our poet, Teardrops.
Hello, ladies and gentlemen. My name is Teardrops. I'm a poet from Nairobi, Kenya, and I'm an NTD advocate because I think it's a right for every person to have access to a clean water and to live in a clean environment. And we are here to pass the message. So stay safe, keep your environment clean, live a healthy life. Teardrops say so. Bye-bye.
Alrighty then. So what can we do? How can we help? Hopefully, throughout this program, you have received a lot of information, both from our speakers and the experts you've been able to talk to, because every problem is an opportunity after all. So I've changed my own mind in terms of how I look at problems. I no longer look at problems. I now go, ooh, a problem! And we can overcome all of this. And to talk about the first steps, we will now go to the founder of the Future Africa Forum, Gerald.
Hello, everyone. Gerald Chirinda here. I have been so energized and motivated by today's event. This is a true testament to the power of community. Now, you can agree with me that the various contributions by various generations have been extremely valuable. We can achieve so much when we bring together our various skills and talents for one important cause. Now, you're all here representing billions of people who are infected and affected by neglected tropical diseases. And that is such a huge weight, and one which we cannot shoulder on our own as individuals, but rather as a collective. So in closing, I have a call to action that we have put together, and we are requesting you to participate in. We want you to sign, share, and stand for an NTD-free generation by 2030. The link is provided below. Thank you so much for your time. Thank you so much for your contributions. Thank you so much for your energy. We look forward to an NTD-free generation by 2030 with you.
And we have come to the end of today's proceedings. If you have learned as much as I have learned today, your brain hurts. I need to lie down. But it has been such a pleasure to hear from all of the experts and to get a piece of the energy that you're all putting in to becoming global problem solvers and moving towards a much better world. And one that is NTD free. Thank you very much for having me. I've been your host, Loyiso Madinga. I wish you all the energy, the power, the chutzpah to move forward and do wonderful things. Have a wonderful, wonderful day. Cheers.